Hello, I'm Sean Park, prosthetic urologist practicing in Seoul, South Korea. One of my field of interest is sexual medicine and the STI treatment and prevention. Today I'm going to talk about two kinds of PrEP. Actually, one is a PrEP and the other one is a PEP. So what is a PrEP? It is a pre-exposure prophylaxis. As we know, for the HIV, it is very important to prevent it before getting caught and get treated. Because once HIV is in our system, it's impossible to get it cleaned. So we have to deal with it for the rest of our lives, and there are many social stigmas and all the things. So get it prevented is, I believe, much better than to get treated afterwards. How can we do that? Luckily, now we have a method named as PrEP. So there are several kinds of drugs which can do that. The first one introduced was Truvada. This one is Emtricitabine&Tenofovir. And now the next generation of the drug showed up as well. The Descovy, which is Emtricitabine&Tenofovir alafenamide, which has a lower footprint on liver and the kidney function than the Truvada. So these drugs can prevent HIV up to 90%. If the patient is on the PrEP, then they can achieve the pretty good protection against HIV. But these drugs do have some side effects. They have somewhat burdensome to your liver and kidney, and it can also decrease bone density. There was a kind of concern. Actually, initial Truvada has a more burden on your patient's liver and kidney. So now the next generation Descovy, however, has a lower footprint than that. If somebody has with a lower kidney or liver function, they will want the Descovy, or just if they want to prevent that, Descovy might be a good option. And also, there is another way to get the effect of the PrEP, which is on-demand PrEP. So not everybody has a very active sexual life. In a case like that, so a patient can take 2 pills 2 to 24 hours ahead of the sexual intercourse. After sexual intercourse, 24 hours after that, he will take another pill. And 24 hours after that, he takes another pill. So in total, patient needs to take 4 pills, and then they can have a similar effect like a daily PrEP method. So on-demand method obviously has a lot of benefits because this will have a lower toll on your body. If the patient is not that sexually active, there's no reason why they should on the PrEP every day. But there's something we should know about the PrEP. So PrEP is not 100%. I said it's around 90% of the protection rate, which means that even the patient was on PrEP, they can become HIV positive without any sign. So if that's the case, patient should stop the PrEP immediately, and then they need to get treated to HIV. If they don't do it, if they keep taking the antiviral medication as a PrEP, then the virus will develop resistance against the PrEP drugs, which will make the treatment very difficult for that patient and for the other patients as well. We do not have that many kinds of drugs to fight against HIV. To prevent that, we highly recommend, it is a must thing that we should do, is that every 3 months, patient needs to get tested for HIV and liver and kidney function. It's for your own treatment and for your own future as well. Keep in mind that if you're on PrEP, that doesn't mean that it's bulletproof. So that's about the HIV PrEP, and the other one is about the bacterial infection. So what happened in the US is that once the PrEP for the HIV was introduced, many people thought that when they're on HIV PrEP, they are invincible. Unfortunately, this drug is only for the HIV. It's not for the gonorrhea, chlamydia, or mycoplasma, or other bacterial infection. As you can imagine, the infection rates of those bacterial infections skyrocketed after the PrEP was introduced. Probably because of that, university settings and doctors in that field thought that, what about bacterial infection? Can we prevent it? So that's why they invented a method as a Doxy PEP. PEP is a post-exposure prophylaxis, which means that you take pills after you are exposed to the sexual intercourse. So the method is that you take 200 milligrams of the Doxycycline within 72 hours after the sexual intercourse. Generally, one Doxycycline pill is 100 milligrams. So if you take 2 pills within 3 days, they can prevent syphilis and chlamydia up to 70% and coccal infection up to 50%. there's a pretty good protection rate. So these methods definitely help you with preventing the bacterial infection. But again, it is also not a bulletproof. So if you had a somewhat unprotected intercourse, the best is that you get screened and tested if necessary. But still, doing the Doxy PEP is better than nothing. Actual recommendation from the CDC is that these methods should be have a proper overseers who can help them and investigate and give them services of the testing and treatment if necessary. But still, this method, Doxy PEP, can give the patient an autonomy that they can prevent the infection in a good range of chances. So I think these two methods are very vital and very important for the many people who can enjoy their life without worrying about this kind of infection. If you have any questions about this, you can always contact us or local providers like a urologist or a sexual medicine guys who will be able to help you out. It is a shame not enjoying your life, but at the same time, we have to prevent ourselves from having a disease. So this method can make the people enjoy their life more freely, but at the same time, one should always be mindful about how these methods should be implemented.